Hi there, welcome. If you click on this video, you may have heard of Canada's opioid crisis and the term harm reduction. If you have, you may have only heard one side of the story. In this video, we hope to provide you with the more comprehensive view of the opioid crisis and emphasize the importance of harm reduction. Harm reduction is a term used to describe public health approaches that are designed to minimize negative consequences relating to misusing substances, including alcohols and drugs. This includes a range of policies, practices, and programs proven to reduce the harms that may be associated with substance use. These include safe consumption sites, needle exchanges, opioid substitution programs, education, and naloxone. The term itself began appearing in Canada in the early 2000s when Canada opened its first supervised injection site in response to the staggering number of opioid overdoses. This is a location where individuals can use drugs in a stigma-free environment using sterile equipment with the support of healthcare providers. Canada's Public Health Agency has identified three main reasons for the rise of opioid overdoses. The first reason was the prescription of opioids. During the 1990s, many were unaware of the addictive nature of opioids. The overprescription of opioids for acute and chronic pain by physicians significantly contributed to the crisis we see today. A lack of understanding of opioids' addictive potential led to misuse for many who had otherwise never interacted with drugs. The second reason is the criminalization of drugs. Criminalization of drugs contribute to the vicious cycle of stigma because people who are criminalized are less likely to get employed, get clean, and get support. Now, harm reduction workers are hoping to move Canada towards a decriminalization model of substance use. Decriminalization is an evidence-based strategy aimed at reducing the harms associated with the criminalization of illicit drugs. These harms include criminal charges, stigma, high-risk consumption patterns, overdose, and the transmission of blood-borne disease. Decriminalization aims to decrease harm by removing mandatory criminal sanctions, replacing them with responses that promote access to education and reintegration back into the society. It is not a single approach or intervention. Rather, it describes a range of principles, policies, and practices that can be implemented in various ways. The third reason was that we observed the contamination of fentanyl into the drug supply. Fentanyl is an opioid that is 100 times more powerful than morphine, which when ingested increases the likelihood of an overdose. Its potency poses a concern for substance users as they may not know that the drug they're consuming has been contaminated with fentanyl.
Or 5 years as the opioid crisis has emerged, we now see more people coming to use our harm reduction services. So those include an on-site needle exchange and other supplies for people who use substances. Family that person chose this situation. What that does is then that just isolates and diminishes people and kind of pushes them further out of the mainstream, more into marginalized population. That's the word I was looking for, and therefore are now really struggling to have access to the system, or the system doesn't really provide adequate access to them because they are experiencing barriers when they get there, or they're not comfortable in that space. There's a fear of criminalization involved, and that's another element that would make someone not want to access a traditional health service. So those myths have been compounding. They are still a big source of stigma, which we deal with in our community, in the HIV community, for years and years. Still deal with it, and that one is just another level of or layer of stigma that gets compounded on the population. Continuing to make sure that these services are provided, because they're saving lives. So if you reduce it to that level, that it's simply a life-saving provision, this is what has to be done, to the very important provision of naloxone to people. And that can be very much a very practical thing that can be done right across the board, across the community. All of you could have naloxone kits in your work, and it'll turn out to be a very important piece of equipment